Why did we make a special manual for children? First of all, when we were implementing the women's manual, many asked about what about children? What about boys and men? And what about children? And it's also so that for children, the children's rights is different or is specialized, and also we examine what kind of manuals are there already that we shouldn't copy or be a parallel to. But it's many good manuals about prevention from UNICEF and from WHO, but we didn't find any good manuals about how to help those who were exposed. So that's why we wanted to do a special manual for children. We wanted it to be human rights based, as the others are. We want to have to focus on the psychological, not only the legal consequences, but also the psychological consequences for the child and also for the family. We know that it's a lot of work about trauma in general, but we wanted also to specify what's special for sexual abuse. We wanted to be resource-oriented, and we wanted also to include different kinds of local experiences. We wanted to give tools, both for doing trainings to help helpers, but also tools directly for working with children. And we wanted it to be adapted to different kind of cultures. So even if it's written by a psychologist who have been clinicians, it's meant for helpers in different kind of with different kind of professions. The manual is both as a workshop manual, so it's exercises for the participants in the workshop, but it's also the tools directly for children. It's like this. It has an introduction saying to whom this is for and how to use it. It's also meant to be self-explanatory. Then in the women's manual, we had a metaphoric story, the butterfly woman story. In the men's manual, we had 4 cases that we, who were writing the boys and men manual, had met. But in this manual, we actually wrote to different kind of organizations all over the world and asked for them to send cases to us. And we gathered 12 cases that is included in the manual, but we used 4 of them, especially for when we talk about how to understand the reactions and when we talk about how to help. We used these 4 cases as illustrating. And then we had in all the manuals, in all the manuals we start that the most important tool is actually you as a helper. So we always start the manuals with how to be a good helper, and we always start the workshops also with an exercise where people are expressing what they think is a good helper. And then we have people ask for tools very, very soon, but we also think you have to know why. You have to know what you need to know and to understand about the dynamics behind the reactions and why the tools are helping. So we have the chapter about what you need to know when you are working with sexual abuse, and then we have what you need to do. And we have a special chapter about additional tools. And then we end up by going back to the helper again and to see how can you take care of yourself as a helper. So that's the structure in the manual. We use the definition from WHO. That's sexual. They talk about 3 different kinds of abuse, and the sexual abuse is defined as it occurs when a child is involved in sexual activity that is, it does not fully understand, to which it cannot give informed consent, and for which it is not developmentally prepared, or that violates the standards of the society in which the child lives. So that's our definition. And we said your number was much higher, I think, from the Red Cross. We used a sort of overview that we found that at least 12.7% of children have been exposed to sexual abuse. But we think the number is, of course, much higher because also, as you mentioned, boys are very seldom reported. Yeah, here's the illustration of the good helper. We ask, when we have a workshop, we ask each little group to make a drawing of what do you think a good helper needs. Here's the one from the women's manual, and it's from Africa, I think. Congo. Yeah. Big feet, big heart, big bladder, so that you are patient and can listen long. Yeah. And we ask these questions, and we are asked for a discussion in the group about what you think in your country, in your culture. What is most important here? Yep. Then we have to be certain that we all agree upon the definition of trauma, that it is defined as a major physical or mental injury, including threats to life or physical integrity or being witness to somebody close exposed. And we use the classical, that the immediate response when you are meeting danger is this fight, flight, or freeze response. Yeah. But for children, it is not only the classical PTS symptoms, the avoidance, the arousal, and the intrusive memories, but it's also different from in what age are you exposed to this sexual abuse. And children have different developmental tasks, so they can be disturbed. So we see that it is different reactions in different age groups, that the attachment is especially, it's always affected, but it's especially vulnerable in the first period. And you very often see that children have a regulatory difficulties, not only regulating their emotions, but also regulating their body. We see that preschool children have a lot of separation anxiety, sleeping problems, and we see then the start of that play is also so much affected. That play is somehow, sometimes the child is unable to play because fantasy is not really, reality is even worse than what the fantasy can imagine. And we see sometimes children going backwards in development, that acquired skills are reduced again. And we see this more aggressive behavior and learning problems in the school children. And sometimes with teenagers, we see, also with younger children, inappropriate sexual behavior. But also in teenagers, we see much more guilt and shame, and that they feel that they really can't identify with other adolescents. They are not similar to other adolescents. So next. So in the need to know, we actually start with what we call the triune brain, that our brain is built from below and up, and that in the lower part of the brain we have the regulatory system, our breathing, our respiration, our heart rhythm, our muscle tonus, and our bodily sensation. And then you have the limbic system with the emotions and the memory. And then you have the prefrontal cortex. And very many people want to talk about the trauma to children. But sometimes you have to start really from regulating them, then relating to them, then talk about it. Yeah. So in the need to do, we start by how do you regulate, how do you help them naming feelings, and then how can we talk about it. Sexual abuse is, as I said, not only a trauma, it's a specific trauma. It has, I think in the play we saw, he said something about feeling inferior. I think what my clinical experience is that sometimes you see even very strong self-hate. So it's really self-destructiveness and self-hate. And it's lack of trust, because sexual abuse is not only an invading, but it's also a betrayal. Someone you trust, someone who should protect you, are abusing you. So it's a terrible betrayal. So trust, building trust is very important, because that is really being destroyed. And we see also a tendency to be re-victimized. And I asked one of my patients to tell me, why do you think this has happened from several perpetrators? And she said, it's no mystery. I freeze. I freeze every time a boy tries to touch me, I freeze. And then he sees that I won't resist back. We see sometimes self-destructive behavior and sexualized behavior. And we see forgetfulness and fragmented memory. That my life story is somehow I'm not able to make a coherent life story. So next. And we discussed in this manual about how do we know? How will the child convey his story? Because most children don't tell. Because for many reasons. It's also because they have been threatened that something will happen to them or to their parents, and sometimes the offender is also someone that they care for. So they don't want to tell because they don't always want a sort of revenge towards the perpetrator. And another reason is that they don't know the words. What should they say? What was this? It's not easy for a child to really know what is ordinary and what is seldom. And it's also that it makes them discomfort because remembering it, talking about it, brings it all back. And they want to be normal, and they need protective grown-ups. They don't want to lose their protectors, even if they hurt them. So we need really to listen, to be able to see how do they convey their story. Sometimes in drawing, sometimes in play, sometimes in symptoms. Sometimes they do it in writing. Many teachers has got an essay in school, and what was this? Is this something you have experienced yourself? etc. So, and sometimes we know that children has a memory system that makes it more difficult for them to have a sort of what we call free recall. But they can, if they see something that's similar or they hear something that's similar, then they can start talking. So we practice in the workshops, we try to practice what is active listening. What is really, and it's hard sometimes when children, just a small example, I was reading a book for a girl about our body, and then she suddenly said, I said, no, no, no. You know, and my head was full of questions. To whom, to what, where, and when? And I had to restrict myself and say, you said no, no, no. And she said, and he did it anyhow. And all the questions in my head had to be stopped because I just repeated and said, even if you said no, 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 he did it anyway. Yes, he put his penis into my mouth. And so you have the active listening capacity is really also to hold back many of the questions that we as grown-ups have in our head. Yeah. So we do, as I said, we do, when we work with children, we work with the regulatory system, we work with breathing exercises, muscular tension exercises, playing motoric activities, etc., in order for them to get a sort of more sense, more knowing their own body. And we, here is a breathing exercise. We help them, for instance, by making a drawing of their whole body and asking them for different colors of what's the color of sadness, what's the color of being scared, what's the color of being happy. And we try to make them more bodily aware of which kind of feelings are in your body now. And where, in what kind of places do you feel more sad, more frightened, etc. And sometimes we also use screening instruments, asking more direct questions, and that's sometimes possible for children if they understand that this is a question posed to everybody. So it's not because it's something special with you. And we got a question when we wrote this from the why do we in the women's manual say that you shouldn't ask directly whether you are abused or not. But for children we have a duty to report because the abuse might be going on. So we really have to try to find out. Yeah. So I included this from Atle Dyregrov, famous Norwegian trauma expert. How do we know when trauma is, when it's healed? So we have to have some kind of knowledge. Now this is in the past. It's when the child is able to tolerate the pain and be able to memorize it. When they can manage their own reactions in their body, when the trauma part is a part of a coherent narrative, when they actually have some more self-esteem and are able to appreciate themselves, and when the most important attachment relations are re-established, and when meaning and hope for the future are established. I just wanted to show you. We are going to talk about implementation later, but it was a very nice experience in Nepal, where Lise and I did the workshop, and also when Mari and I did the workshop in another workshop, also in Nepal in November last year. And then, also we had, for me it was really exciting to do a training of trainers, a webinar with trainers, so that they now in Nepal have their own workshops. They are carrying on with the work that we